Hello and welcome. I am Ashok Rajguru, and in this presentation we shall be looking at the pathophysiology of the condition which is discussed in the case in this particular lesson. The pathophysiology being considered is that of a very common complaint, which is nasal congestion, often described as rhinitis, allergic rhinitis, non-allergic rhinitis. But essentially, the pathophysiology is the same for all these conditions. The objectives of this lesson: to understand the pathophysiology of rhinitis. We will also be taking a look at comorbidities, or what goes along with rhinitis in many cases. What are the effects of allopathic medications? And we will try to understand sensations and modalities from a different perspective. As all of us understand, sensations and modalities in particular are of tremendous importance when it comes to the choice of remedies. Now, the first question I would like to ask is nasal congestion a perception or a reality? Basically, we say we have a blocked nose when we have fullness, obstruction, or reduced airflow. People use words or expressions such as I'm feeling stuffed up, or my nose is stopped up, or similar terms. So the question that arises is, what exactly is nasal congestion? Now, by definition, it is actually a perception of reduced nasal flow. I have put those words in bold. It's a perception of reduced nasal flow. And it involves a lot of underlying mechanisms. It's not just a very simple case of a perception or of a physical factor. We will be examining what those underlying mechanisms are in this particular presentation. Now, working on perception, all of us are familiar that at some time or the other, some of us may have used, or some of us may be aware that people use inhalers, which is supposed to clear stuffy nose. Now, what exactly do inhalers do? Do they act upon the nasal tissue in order to reduce some physical obstruction, or is it otherwise? In reality, inhaling mentholated vapors activates the cold receptors, the sensory receptors which sense the thermal conditions in the nasal passages. They activate the cold receptors in the nasal passage. And the cool sensation that is created gives the impression of increased flow. It's only an impression. It's a feel-good factor. So that's why you must understand that it does not actually alter the airflow. It just gives you a feeling or an impression of increased airflow. And that's pretty clear even in the wrapping or the pack which is sold across the counter. This information can be obtained from the following reference. And as you can see, the wrapping on the pack, this pocket pack, says it makes breathing feel clear and cool. So it's pretty clear, it makes you feel. It doesn't really do anything physically. Something very important to understand. When you have a patient who is presenting, we must understand the language of the patient and not confuse it with some physical entity. Here is a diagram which is pertinent to this particular condition, which describes the anatomy of the nose from one particular perspective. As you will see, it shows the location of the sinuses. Very often the sinuses get blocked with mucus, and that can cause a problem with that feeling, subjective feeling of being stuffed up. Also, inside the nose, you will find we have got turbinates. Okay, these are small structures which are there to regulate the flow of air inside the nose. And what they have found is that even in patients who have undergone a surgical procedure known as a turbinectomy, which means all these turbines, the superior turbinate bone, the middle turbinate bone, and the inferior turbinate bone have been removed, and what is known in medical circles as an empty nose, even such people who have no reason for having any physical congestion, they may still complain of the perception of nasal congestion. Something very important to note and to understand. So here is a reference. And mind you, all these references will be available separately in the module. Here is a close-up view of the turbinates. They have been marked by these white circles. And the surgical operation involves removal or trimming of these particular bony structures and the associated tissues to perform a turbinectomy. And as we mentioned, even with this empty nose, as they call it, a person may still complain of nasal congestion. Now, this condition is actually part of the natural immune response. Why do we get a stuffed nose? Why do we get a runny nose? Why do we have sneezing? Now, all these are actually part of the natural immune response. So the first condition that is required is a condition that acts as a trigger, which can be an irritant, such as an infection or an allergen. That triggers the inflammatory response, which means that there is increased blood flow because blood carries those factors which are required to fight the infection or to drive the allergen away. It results in an increased blood flow, which results in higher vascular permeability. Now that results in secretions. That results in vasodilation, which gives rise to swelling and which does affect the sensory perception. Now, all these things, including the mucus secretions, they are likely to block the sinus drainage pathways and create a physical obstruction as well. But we must understand that this condition need not be brought on only by allergens or germs or viruses. And why is that so? The reason for that is that our nose is armed with a very complex nervous system, and it includes sensory, sympathetic, and parasympathetic nerves. And all these things can be affected by our emotions. So a person could be suffering from rhinitis, not just because he's exposed or she is exposed to some allergen or because of some germs or viruses in the environment. It could be having a very important emotional trigger as well, and that is important for us to understand the symptomatology of a patient. These are the references, but as I said earlier, they will be listed separately in the lesson. Another important thing to understand is that hypertension and the stuffed nose seem to have a very close relationship according to the recent research findings. What they have found is that hypertension is found most frequently or more frequently in men with rhinitis than in men without rhinitis. Now, this particular study doesn't make a mention about the feminine gender. It talks more about only about men. The second point to note is that it is recommended that blood pressure should be regularly checked in men with rhinitis. There is a relationship, so we can describe that as a comorbidity, something that exists together. Also, as we know, in homeopathic analysis of a case, concomitants form a very important limb of our analysis. So this should also be taken into consideration. The third point to note is that the physiopathological mechanisms underlying these associations, that means the association between hypertension and rhinitis, is not really understood so far, but it does seem to exist statistically. Research seems to suggest that treatment of allergic rhinitis can improve blood pressure. So this is just a corollary of what is stated in point number two rather, that blood pressure is not only associated with rhinitis, it has also been found that if you treat the allergic rhinitis, you can also improve the blood pressure. This will be a key point of discussion when we take up the case later. Another important point to note is about the sensations and modalities of the nose. This is a very interesting feature that we should be aware, that the stimulation of sensory nerves leads to sneezing and the pruritus and the nasal discharge and the nasal congestion. It's actually also leading to hyperresponsiveness to non-allergic stimuli such as cold air or light, etc. So you must be able to elicit from your patient what are the aggravating factors. As we said earlier, we must know about the comorbidities such as hypertension, but we should also take note of non-allergic stimuli. Some people will tend to sneeze more if they are exposed to sunlight or if they look into a strong light. Some people are affected more by cold air. And of course, the usual time modalities and other such things also must be taken into consideration before arriving at the correct remedy. Another interesting point to note, and which is sometimes either not known or overlooked, is that each one of us has a particular nasal cycle. In other words, if you just try to explore this with yourself, you will find that at any given particular point of time, one nostril seems to be having a greater amount of airflow as compared to the other. There is no pathology in this particular case. It is just a natural human function. This was very well known to the yogis, and yoga understands that very well, but increasingly it is also being included in the understanding of the anatomy and physiology of the nose. The fact of the matter is that one nostril decreases its airflow rate and the other nostril has a higher rate of airflow, and this alternation takes place every half an hour to 3 hours. It depends on the individual. And this particular resistance or the nasal cycle is actually regulated by the sympathetic nervous system. One interesting fact is that this is also influenced by our proprioceptive stimulation if it happens on the side of the body and specifically to the armpits. That means the axilla and to the hips. Now you will notice that if you are having a blocked nose and you happen to sleep on one side, the nostril which is on the higher side will start to have greater airflow. So if somebody is having a right nostril which is appearing to be blocked and having reduced airflow, that person sleeping on the left side will relieve the condition in a very short while. The same thing applies to axillary stimulation, which means if you happen to put a tennis ball under your armpit on the side opposite to the blocked nose, you will be able to find some relief. This is also known as the crutch response. You know, like a crutch under the armpit, it happens to work on similar lines. Now, pressure applied on one side of the body causes what is known as a ipsilateral nasal venous congestion. So these are good facts to know, and they can also be used to help your patient to relieve them of the condition. If they are reporting blockage on one nostril, you can ask them to lie down on one side or maybe use a ball or a rolled up towel under the armpit in order to get relief. Because the only other option that is left with you is the patient being driven to take a nasal spray. But in a later discussion or presentation, we will look at alternative therapies such as the neti pot and nasal irrigation to overcome the situation for case management. Another point to remember is, having said and understood that rhinitis and hypertension are comorbidities, you must educate your patients that a lot of decongestants which are in common use are contraindicated if they are suffering from high blood pressure. Decongestants that relieve nasal stuffiness have a direct impact in the negative sense on blood pressure. That means they tend to increase blood pressure. These are the drugs which are normally used, pseudoephedrine and other derivatives, and all these oral nasal decongestants and metazoline, oxymetazoline, all these drugs happen to impact blood pressure as well in a negative way. Even inhalers like the popular Vicks vapor inhaler tends to increase blood pressure, so it's contraindicated for people with hypertension. Even hemorrhoidal products which are applied topically, because they also act on the venous membranes, and as we have seen in the review topic of this particular lesson, remedies happen to act on tissues even remotely. So if somebody is using a topical hemorrhoid product for hemorrhoids in the rectum, it can impact blood pressure. This is something that should be understood and explained to the patient. Asthma alleviating products which contain ephedrine and aspirin also affect hypertension. Even the non-steroidal anti-inflammatory drugs such as ibuprofen also have a similar effect. So I'll just summarize what we have seen in this particular presentation. We had a look at the pathophysiology of rhinitis. We saw the structures of the nose, and we have come to understand that a stuffed nose has to do not just with physical obstruction but also with perception. We also had a look at comorbidities and the relationship between hypertension and rhinitis. We also took a look at the effect of the allopathic medications and had a look at what are the sensations and modalities that one should elicit in analyzing cases which relate to this particular condition. So that's all for this slideshow. Thank you very much for your attention, and please participate in the forums and post your comments, your questions, and that will just help us to develop this topic further. Once again, thank you very much, and bye-bye.